Hello and namaskar. My name is Dr.Ankush Sayal. I'm Senior Consultant ENT at Primus Spcaility Hospital. And today we will talk about this interesting topic, also known as sinusitis or rhinosinusitis. And nowadays it's a very common problem amongst our generation to be suffering from sinusitis. Now, sinusitis, also technically referred to as rhinosinusitis, is basically the inflammation of the nose and the paranasal sinuses. Now, these paranasal sinuses are basically the hollowness within our bone, and these can be either maxillary sinuses or ethmoidal sinuses, or ones above our eye, which are also referred to as frontal sinuses, and the one at the back referred to as sphenoid sinus. Now, the problem of sinuses can be either acute if it is the problem and the symptoms is less than 12 weeks old, or it can be chronic if it is more than 12 weeks old. Now, there have been various causes for sinusitis, which can be most commonly allergy. This allergy can be to dust or to pollens. Apart from that, there can be structural problems such as a deviated nasal septum. That is the deviation of the nasal septum, or some blockage in the ostia, which can lead to this kind of problem. Apart from that, there can be certain medical conditions such as cystic fibrosis, gastroesophageal reflux disease, or certain problems in which the immune system gets compromised, such as HIV, which can also lead to a problem such as this, that is sinusitis. Other than that, patients with sinusitis also can have associated asthma. They can have sensitivity to certain drugs such as aspirin, and of course smoking can increase the risk to development of sinusitis. Patients with sinusitis are generally tend to have two of the problems which I'm going to discuss with you. These problems can be in the form of nasal obstruction. They can be in the form of purulent yellow colored nasal discharge, which can either come out frequently, they might have to blow their nose frequently, or can fall in the throat, which we also refer to as postnasal drip. Along with that, they may also complain of any facial pains or heaviness in the face, or they may also complain of associated fevers, dental pains, loss or less smell that they frequently come across. Along with that, there can be problems in the throat. Patients might complain of recurrent sore throats, or problems in the ear in the form of decreased hearing, fullness in the ear, or even recurrent ear pains. The management for sinusitis involves, first of all, clinical examination, in which we try to do a diagnostic nasal endoscopy, in which we try to examine any purulent, that is yellow colored thick nasal discharge within the nasal cavity. Along with that, we are trying to look at the condition of the mucosa, which could be red in color, increased redness, or in the form of a deviated nasal septum, the midline septum getting deviated, or in the form of polyps, which are basically hanging mucosa within the nose. After I've done a clinical examination, I try to further examine the patient in the form of advising a non-contrast CT scan of the nose and the paranasal sinuses, whereby I get to know about the extent of the disease and the number of the sinuses which are involved, and the nature of any structural abnormality that might be associated with it. The treatment of sinusitis is basically depends on the extent of the disease and the duration of the disease. If the problem is acute in nature or short in time span, or the disease is mild in nature, then this can be tackled easily with medical management, which is in the form of antibiotics, which are broad spectrum antibiotics given for 2 to 3 weeks, and of course anti-allergics and intranasal sprays. In most cases of milder problems, patient get resolved with just this treatment. For other patients, those who have had a chronic problem that is more than 12 weeks, or have had associated structural defects, these are the patients that would land up in the surgical category, whereby the patient would require a surgical treatment. The patient, those who undergo surgery would require what we refer to as functional endoscopic sinus surgery. Now, the functional endoscopic sinus surgery is a surgery which is done through the nose using this equipment which is known as an endoscope, which is just 4 millimeter in diameter. With this, we go inside without any incision or scar marks and open up the sinuses, openings of the sinuses, and give them thorough wash and try to clear their drainage and prevent any further blockage. Along with that, those patients who have had any polyps in the nose, then shavers, endoscopic shavers can be utilized to remove these polyps. Certain patients with structural defects might require correction of the nasal septum in the form of septoplasty, which is also done endoscopically using the same equipment. Certain patients also have associated enlargement of the turbinates, mucosa of the turbinates, which are basically bones on the sides of the nose, and this can be reduced using cold plasma, also referred to as coagulation. Using a combination of all these procedures, the patient can be given relief, and in these patients the relief is long lasting. Thank you.